now let's discuss what are the different techniques that are involved in Panchakarma. So part of this process, just to give a little overview in Panchakarma, is that we're working on really bringing all of the toxins that are in our system that might be in different organs or part of our circulation. Ayurveda believes we're trying to move all of these into the GI tract. And this is because each of the three doshas has a home site in the GI tract. So we have kapha that resides in the stomach, pitta that resides in the small intestine, and then vata that resides in the large intestine. And so as we work on moving toxins into the GI tract, then we can get those accumulated doshas in the GI tract to be eliminated. And so we have specific techniques that target the stomach, the small intestine, and the large intestine in order to be able to do that. So before we get to that process, we want to first start to move the toxins into the GI tract. So one of the first techniques Ayurveda uses is called snehana, which means oil massage. And so Ayurvedic massage is very different than the typical massages you might be used to. We believe in using medicated herbal oils for these techniques. And so these medicated herbal oils will be chosen, once again, based on your predominant dosha or your doshic imbalance, based on the season, based on the climate, whether we want to have a cooling effect or a heating effect. So all of that will be determined by the Ayurvedic doctor at your Panchakarma center. Once we've chosen those right medicated oils, they are warmed up. So it's really important to use heated oil on the skin. So it's going to be absorbed, it's going to be penetrated deeper into the skin, into the joints, into the muscles, the tissues, and it's going to have a stronger therapeutic effect. The Ayurvedic massage therapists are trained in specific techniques that help to stimulate circulation, movement and flow of toxins, moving things towards the GI tract. So it's a very systematic massage, and it's done by two massage therapists at the same time. So it's kind of like synchronized swimming. Ayurveda believes you can't balance the right side of the body without balancing the left side of the body at the same time. You also can't balance the top, the head, without balancing the feet at the same time. So this concept of polarity is very strong. There are Ayurvedic centers that might not have two massage therapists. They might just have one massage therapist for practical purposes, especially in America. In India, you'll see most people will stay with that tradition of using two massage therapists to do this synchronized massage. So once you've had a four-handed massage, it's very difficult to go back to a two-handed massage. It's very luxurious. It feels amazing. So this is part of kind of like the opening of the Panchakarma experience. Is every day for your 7-day detox, you'll be getting this Ayurvedic massage. The therapist might change the type of oil that they're using from day to day or with certain conditions or whatever they're trying to target. So that's a possibility. And then part of the Ayurvedic massage experience is they're also trained to give emphasis to some of the Marma or energy points on the body. So if someone's coming in with a lot of digestive issues, they might do some extra work focusing on the Marma points in the abdominal area. If someone's got shoulder pain, they might focus on some of the Marma points in the shoulder area. So I'll be sharing about the Marma points in more detail with you soon. So once we've done snehana, which is the oil massage, there's some other things that might be done at the same time as that. So one of the Panchakarma techniques is called nasya. Nasya means medicated nasal drops. And so this is administered by one of the practitioners when you're lying flat on your back, the head is tilted back, and then we're putting 5 drops, 3 to 5 drops of this medicated oil in each nostril, and then you're inhaling that with the head tilted, so that oil is really moving up the sinuses. This is a great way of cleansing out the sinuses, wonderful for all sorts of sinus issues, but the nasya also has a very nice effect on neck and shoulder tension, and it benefits the head. It's excellent for headaches and migraines. One of the #1 ways to treat that in Ayurveda is through nasya, because it is so powerful. And there's various herbs that are mixed together to create these nasya formulations. So nasya is a nice technique that might be done right before the massage starts or right after the massage as a possibility. There's also another technique called karna purana. So karna means ear and purana means to fill. And so while you're lying on your back, your head will be tilted to one side. The therapist will put some warm sesame oil potentially or some other type of herbal oil, not too hot and also not too cold. So you have to really test the temperature. And then the ear is filled with that oil. You're resting for a minute or two, and then the head is turned to the other side so that one ear can drain while the other ear is filled, and then same thing, that head is turned to the side to drain. So that's a technique that sometimes can be done during the massage itself or right before or right after. Feels wonderful. It's a nice remedy for tinnitus and for ear pain, but also very soothing and grounding for vata in particular. So we've done our nasya, our karna purana, our snehana. This is then oil massage is then followed by svedana. So svedana means therapeutic steam. And so this can be done for the whole body. So there were traditionally little boxes, steam boxes that you could sit in, which is the head outside, and then it's heated to a nice temperature. There might be some herbal steams that are done for creating, once again, a specific therapeutic effect. And then usually about 10 to 15 minutes might be the amount of time you're in the steam. This also, once again, varies by dosha. For kapha people, they can really tolerate the most amount of steam. Pitta starts to get aggravated by the heat, so they might be a little bit shorter duration in there. And then vata gets the most restless, but the steam is really excellent for them. So all three doshas are going to get the svedana, the steam, but depending on their dosha, they might have a different amount of tolerance for that heat. If you're sitting in the steam box, one thing that can be done by the therapist is sometimes they give you a nice cool wet cloth that you can just put over the heart area to keep the heart area cool. They might give you another one to put over the genital area to keep that area cool as well. And then sometimes they might give you a cool wet cloth halfway through the steam that you can just kind of put on your forehead to bring the body temperature down and to just create that feeling of relaxation during the steam. So it's very important to do the oil massage first before the steam. That's what's really preparing the body before we can kind of sweat out those toxins. So everything in Ayurvedic Panchakarma is done with a specific sequence. So now after we have finished the steam, there might be other skincare treatments that are done. Sometimes there's a nice treatment of dry brushing the skin. That's a wonderful treatment for the whole body. Sometimes there can be a nice herbal paste that could be dry, or sometimes that's wet. So it might be mixed with water, it might be mixed with milk, have rose leaves, different herbal ingredients that just are a wonderful way to detox the skin and also helps to absorb all that oil that we've applied on the body. So some Panchakarma centers might offer some type of skincare treatment like that afterwards. There are also some other kind of Ayurvedic massage techniques. There's one called Pizzy Chill, where it's kind of a continuous stream of oil that is dripped onto the body and very luxurious and super relaxing. So that feels wonderful to do as well. There's another technique called Pindasvedana, which is like a bolus of herbs that's been cooked and put into like a white cloth. And then that is used on top of the body, but the therapists are doing this with kind of a vigorous pounding action. So as they're moving, and it's heated, so as they're moving these warm heated herbs around the body, it's very stimulating, it's great for circulation, it's great for pain, for blockage, just very, very invigorating. So that could be done as well as another kind of body care, skincare therapy. So after we have done all of this, then oftentimes we are bathing afterwards. We don't want to use any type of soap on the skin after the oil massage, but usually there's a nice chickpea flour that could either be dry or mixed with water to create a kind of soapy consistency, and that's used to rub on the skin to cleanse the body and to kind of preserve the oil to penetrate deep. And regular soap is usually not going to take all that oil off. So once again, it feels very luxurious and is great for the skin. So this is a quick overview of all the techniques that are now leading up to our 3 remaining karmas or actions in Panchakarma are Basti, Virachan, and Vaman. So I want to go through each one of these 3 techniques that targets the GI tract. So Vaman is the term for therapeutic vomiting, and this targets excess kapha that builds up in the stomach area. If you don't have excess kapha, you would not qualify to do Vaman, and this would not be recommended for you. So once we're building up that excess kapha, then there are specific emetic teas, herbal teas that are prepared. And so this is kind of building and building this excess kapha in the stomach. Then you're recommended to drink these series of herbal teas that the Ayurvedic doctor is observing and watching you and making sure that you're doing this correctly. And then that induces the vomiting. So this might be done for 1, 2, or 3 days in a row, depending on how much excess kapha has built up. But this is a technique that's great for obesity, for diabetes, for asthma, for a lot of respiratory issues as well. Kapha resides in the lungs and in the stomach. So the next technique, Virachana, is therapeutic purgation. And so therapeutic purgation is for excess pitta that we say builds up in the small intestine. And so once this excess pitta has accumulated here, there's going to be specific pitta type of herbal teas that are recommended that act as a purgative and that will cause loose stools. And this is kind of different than when you maybe experience diarrhea and you get dehydrated and there might be abdominal pain and other symptoms. But when you're doing this therapeutic purgation with the pitta herbal teas, it is stimulating the loose stools, but it's really trying to cleanse your system of all that excess pitta, all of those excess stools that have maybe built up in the GI tract. And it has a really light feeling afterwards. So you really feel cleansed, you feel detoxed, and it gives your overall system this feeling of lightness. And then Basti, which is the next technique, is translated as medical or herbal enemas. And so I know enemas is something that's become relatively popular here in the West, but the Ayurvedic concept of enemas is very different. We're not just doing enemas for people who have constipation to stimulate bowel movements. That is, yes, one way that you can use them. But with the herbal enemas that we're doing in Ayurveda, there's always an herbal tea concoction that has been made. So once again, we're targeting the colon, we're targeting excess vata that builds in the colon, and we're using these herbal teas that we are going to use instead of just regular plain water in an enema. We're going to use these herbal teas. So they're cooked, they're prepared, and then we want to, of course, let the temperature cool down so that it's just room temperature or a little bit cooler, and then putting that in the enema bag. And we're giving the patient how to self-administer these enemas here in the West. In India, if you go to an Ayurvedic center, they might administer the enemas for you. And then we're inserting that fluid into the colon. We want to try to sit with it for as long as possible. And so at first, if you're doing this for the first time, it might be a minute or two, and then you get this strong urge to be able to evacuate. But with practice, you can actually start to retain these fluids, sometimes 10 minutes, 15 minutes. It's nice to have some soothing, relaxing music playing in the background while you're kind of lying on the floor, on a towel or a rug or something like that as you're kind of self-administering the enema. And clients love this. There's a lot of resistance at first, but the after effect of enema is quite strong. So not just on the colon, instead in terms of a nice deep cleansing of the intestines, but also a nice effect on the mind. So vata resides in the colon, it resides in the joints, it also resides in the mind. And so after doing an enema, there's often this mental feeling of lightness that we have. If you've ever had severe constipation, where the colon is blocked, then oftentimes you'll experience the mind is also blocked. And until you evacuate, you don't really get that mental clarity in the mind. So that's kind of the wisdom of Ayurveda, of making this connection between the intestines and the mind, and why we need to keep both of them unblocked and both of them as clear channels. So we've done either Vaman, Virachan, or Basti, depending on if we have excess Kapha, Pitta, or Vata. For some individuals, they might have 2 doshas that are out of balance, and so you might be recommended to do 2 of those techniques. And then the final technique I want to mention with the 5 panchakarmas in particular is we've talked about Nasya, we've talked about Vaman, Virachan, and Basti, and then the final one is called Rakta Moksha. Rakta means blood, and Moksha means liberation. So this is our term for bloodletting, which in ancient India, and still actually in India today, at any traditional Ayurvedic hospital, they will use leeches for this bloodletting. And so this is a great technique for excess pitta, excess heat, blood conditions, acne, a lot of skin issues. Rakta Moksha can be wonderful for that. It's great for migraines, pitta type of migraines that have a lot of heat and intensity to them. And so the leech will be applied on the skin wherever local to the affected area, and it'll start to suck out that blood. And the results can be pretty miraculous. I've seen some people with skin conditions, as we put the leeches on the skin, that there's like a visible change in the skin there that's starting to happen right away. So of course we don't have leeches here in the West, and so what I recommend for clients is that you can go to any trained acupuncturist. We are trained to do Rakta Moksha, or bloodletting through the ear, the apex of the ear. And this is a nice way to let out that excess blood, excess heat. So any acupuncturist is trained to do this. Or another suggestion I'll often make is I'll recommend to clients to go and donate blood the week before they go to Panchakarma, if they're doing it here in the West, since there isn't any other substitute at American Panchakarma centers. And that's a nice way to cleanse the blood as well, is to do the Rakta Moksha through bloodletting. And then one more technique I want to mention is Shirodhara. So Shirodhara is not considered one of the 5 main techniques, but it's very popular Ayurvedic technique. It's become very popular at a lot of Ayurvedic spas or regular spas as well. And this is a technique where we have warm continuous oil that's poured onto the 3rd eye, right here on the forehead. This is done while you're lying down. It's once again a medicated herbal oil, and there's a steady stream that's pouring right into that 3rd eye. And it's super relaxing. The temperature has to be just right. And it's usually a brass pot that's hanging on a chain. And there's a little hole right at the end, at the tip, that's allowing that steady stream of oil to come down. And it's a wonderful, relaxing therapy, recommended for stress, anxiety, depression, trauma, really any type of mental imbalance. This is a great technique, but it's also soothing and harmonizing for the whole system. So what my teacher, Dr. Ladd, said is when you do Shirodhara, you can experience silence for the first time. And that was definitely my experience the first time I did this. So profound, went so deep, so much quiet, and it was just very rejuvenating and very lovely. So this gives you an overview of some of the things that you might experience when you receive Panchakarma. And then keep in mind, this is going to be customized. So you might not get all of these different treatments and techniques, but it'll depend on what the Ayurvedic doctor specifically recommends for you. I hope you will all take the time to go and enjoy Panchakarma.